stuff, but we can't have a conversation with you two guys without talking about workflows. So I'd be interested to know what's really drawn you both to studying workflows, and I mean, why are they so important? What is the one message that you could share out to not only our Next Wave Connect viewers, but healthcare industry as a whole about
I'm going to say, Vishal, you're going to start on that one.
All right. So the way I look at his workflow is kind of innovation and the workflow both are important. Even if we want to create a new technology or a new solution to any problem, it is important that it's the steps of that is well planned out. It's like A, B, C, D, and that's only way the outcome can come. The best brains cannot produce what we want to produce without putting them into some kind of discipline or a boundary. So this discipline and the boundary, which could be combination of performance, could be combination of the process, combination of milestones, task management, all this defines the workflow. With each level, what should be the outcome? Measuring whether against that outcome really did that happen, or is there a discrepancy, and make correction. So we got into workflow, knowing the operational issues. Our company's focus as Clinicspectrum, we have been creating technology or kind of combination of human touch to define that workflow, because to build an efficiency, either you need to improve the productivity of people who are working on, or you give them an automation. There are only two ways to do that. So what we decided, the manpower alone cannot serve the ultimate operational efficiency or the workflow planning. It has to be consistency that should come as a natural part of it. And I think the consistency comes more naturally with technology. So the technology piece is put together around your core technology, which is EHR, or practice management, or patient portal, which is very essential for defining this connectivity to different areas associated with the patient. Patient could go to nursing home, patient could go to hospital, patient can be transition of care between providers. All of those, even though interoperability in future can solve some of the problem, it's only going to solve the clinical problem. It's not going to solve many other issues, day-to-day interaction. So I think for me, the workflow being part of electronics engineering and system design specialist and MBA and running a business, for me the workflow was a foundation. The whole business of ours grew to 460 employees and serving thousands of providers is based on the workflow, because